Hello everyone. So I thought I'd make a video, get this little bit of an update up for you, and also I wanted to kind of talking about dealing with the stress of it all. Um, Now this is something that I haven't quite gotten a full hold on, and to be honest, I really don't think I ever will. It's a lot that that we take on. Anybody who's got a chronic disease or something that holds them back from doing things they used to be able to do, or just going through the whole situation, doctors and hospitals and medical procedures, and the list goes on. And so recently, just a quick update, I had the biopsy done, and they wanted to do the liver biopsy because they wanted to test the copper content of it, just to make sure that there was no Wilson's disease. So they just wanted to make sure that there was nothing additional going on, so that if there is, that they're able to, try to stop it from doing further damage. The only thing that I wound up getting out of the biopsy, unfortunately, and not saying that a biopsy is a bad idea. If your doctor suggests it, and he's a liver doctor and he's got reasoning behind it, I do recommend considering doing it. But definitely discuss the things that could possibly happen in the process of it or while recovering. That is something I didn't really do. I was told recovery time was like an hour to 5 hours, and that so definitely was not the case. And throughout the whole thing, the only conclusion we'd come to is that the entire liver is, as they put it, burnt. And I didn't know that was even a medical term. Apparently it is. It pretty much means that the whole thing is just nothing but scar tissue, the entire biopsy through. And they take a piece that's probably close to about a half an inch. Sorry, I'm not so good with the, how much it was in millimeters, but it was about half an inch, which would probably be about 13 millimeters. So it's probably about 12 millimeters, actually. Anyway, so they did the process and they used this, it's like a spring-powered gun that they put a needle in and they pull the trigger and it goes in and it snatches a piece of the liver, and they pull 3 biopsies out of it. And then they have you, lay on that side to hold pressure against it for like an hour, and then sent me home. It was like an hour to 2 hours, something like that. You are not asleep during the process. They just numb the area, and that's about it. And they give you some pain medicine, like your standard pain meds kind of thing. So, but it became extremely painful for me. But it wasn't just the liver area, because yes, the liver was sore, and that I was expecting. But suddenly all my intestines started hurting, and I've got 3 hernias, and they just became excruciating. They were all swollen. It was hard to keep the hernias in, and when they moved, it felt like somebody just had a knife in me and was just, and it was absolutely terrible. So finally I went into the hospital, found out that my hemoglobin was dropping, and they started watching me. And I talked about this a little bit on my previous video. But anyway, finally, after 30 hours in the ER of monitoring it and making sure I had enough blood and all that, eventually the pain did start to subside. So the abdomen pain is a little bit better. I still got this, now I got this new pain at the bottom of my lung when I take a deep breath that I've got to go in and have looked at. And they saw something on an x-ray now in my right lung. It might be blood in my lung that, because the lung itself, but there is an outer shell, and then the lung's like a balloon. So there's a space between that and the lung itself, and that's where the fluid is. Sorry, I don't know the technical term of it. I wish I did. This would be a good time to mention I am not a doctor, nor am I a medical professional. I'm just talking about my situations and what I experienced. However, though, with the results of being like it was, and he said he would explain more what that means and go over more of it in my next appointment, which is the end of August. You know, things really did kind of get to me a bit. And, you know, it was the idea of constantly battling, constantly fighting, and then dealing with doctors and hospitals and being sent away because they don't see anything because, I guess apparently, because the liver's on the inside, they can't see it. So, that just means I'm fine. Um, so, throughout that process and the process of calling doctors and, and this new pain and that whole thing. And then just a month prior, losing the ability, getting diagnosed with the dysphagia and having trouble eating or even swallowing water because it all gets stuck. Because now I got a neurological issue with my esophagus that I've got to get figured out. And I know I'm not the only one that goes through these kind of things. They may be different, fill in the blank wherever that may be, what your situation is. But, it was just really was weighing on me and kind of brought me down pretty far. It's like the process of you start thinking of, why am I constantly fighting? Why am I constantly doing this battle? For me, I don't really have anybody. It's just kind of me. And, it's like the carrying on and the continue going. And I'm sure I'm not the only person that has felt this way. Just so tired of the constant fighting and the constant being sent away from hospitals and things when something's going on and test result after test result. And I'm sure I'm not the only one that was going through that. So I kind of want to make this video, not that I have the answers on how to perfectly deal with that, because I really don't, but I want people to know that they're not alone. And you're not the only one that feels that way. Like, I know for me anyway, sometimes to ask somebody for help, I feel like I'm a burden. I feel like I'm just, constantly needing something, like I'm overly needy. Or, a few friends that I have that I talk to on, that I've met over online and, and I'm talking about it and I feel like I'm constantly, dealing with something and it makes me feel like like you're just kind of a pain in the butt, and these friends, they say you're not, and that's the last thing, when you're going through this stuff you really want to be, especially when you've been independent your whole life. And then suddenly you lose that ability to be fully independent. And now you've got all these feelings and all of these emotions that are coming up, and you don't really know where to put them. And that is a difficult situation to be in. And trust me, I know. And I try to look at the positive side. People say to me all the time, "You're so positive. How are you so positive through this?" And I'm generally positive because of the fact that I focus on something that, that brings me hope, something that makes me want to fight, the hopes of finding this or that. Because yes, tomorrow could bring something bad, but it could also bring something good. And I try to remember that. There's just as much chance in finding something good tomorrow as there is at finding something bad. It's a full coin toss. Maybe tomorrow will just be a regular day. Nothing exciting, nothing bad. Again, it's just kind of a coin toss. But you never know, maybe something good will happen. And that's what keeps me carrying on. And sometimes I forget that stuff and I get really down and just don't really know how to deal with all of it at the time. And I think it's a matter of talking about it when it's really getting you down. And I think that that's important. You know, I mean, and I do know that a lot of people that have cirrhosis and things like that, there are antidepressants that can help with that. And I may even be calling them the wrong thing. I'm not 100% certain. I have not had to use any of those yet. And no, I am not against them. I think if they help, I think they're a great thing. You know, and yeah, from what I understand, most people who have liver cirrhosis are on that kind of a medicine because it helps them just kind of deal with the day-to-day. And, you know, I mean, I've made it this far without. And not saying that, again, not saying that I think they're good or they're bad. I'm just saying I was able to get this far so far without them. And, you know, for all I know, maybe they would have helped previously in the past or what have you or not. I don't know. But I do know that tomorrow's another day. And, you know, I'm going to keep trying to push forward and keep trying to live my best life that I can, you know. And I just want to say to everybody watching, keep fighting. Don't give up, even on your bad days. Because remember, you don't know what tomorrow brings. And, you know, I mean, right now you could be having maybe a horrible day and you're just kind of stuck in your head and you're going through the motions and going through it. Trust me, I was there yesterday or the day before, and, you know, but tomorrow, you know, I mean, yeah, is there a guarantee? No, but I don't know. Tomorrow might bring something. You know, I'm excited to find out. So I guess, you know, I'm going to keep pushing forward and see what tomorrow brings and continue on. You know, and I hope the same for all of you. And I wish there was a simple cure. I really do. And there's really not. It's just a matter of, you know, trying to keep your symptoms down. And when something happens, going in and being checked out. And sometimes that's easier said than done as well. I mean, we all been to an ER and probably been sent home at least once in our journey. You know, they look at you and they go, "Oh, your blood pressure's fine." Yes, my blood pressure's fine because I have hyperportal tension. So all the pressure is in my intestines, not in my arm. Or, you know, "Oh, your temperature's fine." Well, yeah, I don't have the flu, you know, or your oxygen level's fine. Well, my liver's not in my lung. You know, it's like, and they look at these things and they go, "Oh, you're fine," and they don't see anything obvious. And, you know, I'm sure we've all been through that frustration. And it's never easy. It never is. But again, like I said before, you're not alone. There are other people that deal with this, not only with liver cirrhosis, but with other chronic diseases and with other ailments. And there's actually quite a few people out there who fight day to day, like you know, we may, and continue on and continue going. So no matter what you're going through, remember, tomorrow's a new day. I make no guarantees. Tomorrow could be a bad day, but what if it's a good day? You know? And so I'm going to wait and find out and see what tomorrow brings. But anyway, I hope everyone has a great and wonderful day. There is a GoFundMe attached to this if anybody wants to help. I am trying to move so that I can get closer to medical help. Right now where I'm located, I can't even get transported to the local liver hospital. I mean, I sat 30 hours waiting for transport and nobody would send me. So it's, you know, it's just a rough situation. So, but again, I'm sure I'm not the only one. So keep on fighting, keep on going, try to stay positive. All right, take care, everyone.